Hello and welcome to the 2020 Open Enrollment. Here are the items that we will review today. Your Aetna Medical, your dental with Delta Dental, that is new this year, your vision, and your voluntary products that are available. Your open enrollment began on December 18th and will run until December 26th. Please complete either an enrollment form or a waiver and return to us no later than December 26th by end of business. In regards to eligibility, all employees that are considered full-time are eligible for coverage. Additionally, legal spouse, domestic partner, and children up to the age of 26. The benefits that we will review today and that you will enroll in begin on January 1st, 2020 and run until December 31st, 2020. Within those 12 months, you cannot make any changes unless you experience a qualified life event. As you can tell from the screen, here are a few of the examples: divorce, marriage, birth of a child, loss of coverage. Please make sure to notify your HR team within 31 days of the date of the event so you can review your options. If you exceed the 31 days, you will have to wait until the next open enrollment period. Here are two of the plans that you are being offered. The first plan is called the Open Access Managed Choice 1000. Open Access Managed Choice is the network. This plan has a $1,000 individual deductible and a $2,000 family deductible. Your deductible comes into play with major services such as inpatient services, outpatient hospitalization, surgeries, MRIs, CAT scans, durable medical equipment. That is when your deductible is going to come into play. If you happen to meet your deductible in a calendar year, then you're going to go into the cost share of 80-20, which means Aetna will pay 80% of your cost and you pay 20% until you reach your out-of-pocket maximum. Now, if you do reach your out-of-pocket maximum, at that point, you will be covered at 100% in a calendar year and in network. On this plan and all of the plans, your preventative care is covered at 100%, which means your well man, well woman, well child checks that you receive annually at no cost. On this plan, if you need to go see your primary care physician, walk-in clinics, convenience care clinics, or telemedicine, it is a $25 copay. Specialist, $50 copay. And on this plan and all the plans, you can refer to specialists. Urgent care on this plan is a $75 copay. Emergency room is $250. Keep in mind, if you have to go to the emergency room, the $250 and you are admitted, which means you'll spend the night, the $250 will be waived, but at that point you will start to pay towards your deductible. Also, you have 30-day retail supply of prescriptions for some copays. So your generic drugs are either going to be $3 or $10, your preferred brand name $35, your non-preferred brand name $60, and your specialty drugs 25% up to $250. You also have a 90-day mail order available. So if you're taking some maintenance medication and your physician can write you a 90-day script, you can send it in using Aetna mail order. Get 90 days of medication for 2 copays. So a little bit of a savings there. Your next plan is your Open Access Managed Choice 2000, 2000 being the individual deductible, 4000 being the family deductible. Again, if you meet this deductible, you're going to go into that cost share with Aetna until you reach your out-of-pocket maximum. On this plan, if you need to go see your primary care physician, your walk-in clinics, or your telemedicine, it's going to be a $30 copay, and your specialist will be a $60 copay. Urgent care is $75, and emergency room is $250. Again, you have the same copays available on your prescriptions. The last plan you have available is the OAMC 2500 basic plan. So on this plan, your deductible is going to be $2,500 for an individual, $5,000 for the family. On this plan, your deductible kicks in with urgent care, emergency room, inpatient services, outpatient services, hospitalization, MRIs, CAT scans, durable medical equipment. That is when your deductible kicks in on this plan. You do have copays available. They work a little bit different on this plan. So you have 5 visits for your primary care physician, your specialist, or your walk-in clinics combined, 5 combined visits at $35 copay. Once you exceed those 5 visits, then you have to pay the contract and negotiated rate with those providers. Again, your urgent care and emergency room on this plan are subject to your deductible. And then you have the same copays available for your prescriptions. Your prescriptions are not subject to your deductible on this plan, so you can enjoy those copays for your prescriptions without meeting the deductible. Your healthcare or flexible spending account, you have two to choose from, a healthcare and a dependent care. So all three of your plans qualify for the healthcare FSA, or you may enroll in the healthcare FSA without enrolling in any other plans. So this healthcare FSA, you can elect up to $2,500 in a calendar year to use towards your medically qualified services for you and dependents. You do not have to be enrolled in any of the plans, medical, dental, or vision, and neither do your dependents to use this card. Pre-tax dollars that you set aside, and you get your Visa debit card in the mail, and the amount that you've elected is front-loaded into that card. So it makes it very convenient should you need to pay for LASIK surgery, braces, or you're going to use it for copays and prescriptions. So again, $2,500 is the annual maximum. This plan does have a $500 carryover provision, which means you can carry $500 over into the 2021 plan year. Anything in excess of the $500 into the 2021 plan year will be forfeited. Also, if you leave the company, the money stays behind. Dependent care FSA is pre-tax dollars up to $5,000 that you can set aside to pay for daycare or elderly care services. You can either pay the provider directly or pay yourself back. If you have not established a login at Aetna.com, I recommend you do so. You have a lot of good resources available to you at no cost. You have the nurse on call 24/7, 365. The nurse on call will have all of your medical information at their disposal, diagnoses, any prescriptions you're taking. So they may speak to you about side effects, drug interaction, etc., and they can also guide you to care. You also have Global Fit available online, wellness coaching. You can complete your health risk assessment and come up with your own wellness plan. Like everybody else, Aetna also has their mobile app that you can download to your phone. You can have your ID card at your disposal. You can find pharmacy and a local urgent care. Your telemedicine is provided by Teladoc, as you can see here on the screen. Your copay will be whatever plan you're enrolled in. Whatever the primary care physician copay is, that's what it will be for your general medicine on Teladoc. So your general medicine like cold, flu, sinus infection, sore throat, pink eye, UTIs, things of that nature that you can talk to a provider either telephonically or via Skype. Talk to them about your symptoms. They will be able to send a prescription to the pharmacy that's closest to you. It's a good service to have if you're going to be traveling as well. They also have dermatology and psychiatry and psychologists available online. Aetna also has a new wellness program. It is a partnership with Apple, so it works with the iPhone and Apple Watch only at this time. So what it is, it's an app that you download to your iPhone. And if you have a Apple Watch, you can pair it immediately and start earning points. Those points, you can do one of two things. You can pay for a watch if you do not have one and purchase one or purchase a second one, or you can cash them in for gift cards. So Aetna will send you daily goals. The goals are very simple. It could be walking, it may be standing, it may be acknowledging that you've scheduled your teeth cleaning, eye exam, wellness exam, things of that nature. These are actual screenshots from my telephone. This guides you through the app. It's very simple to use. It walks you through on how to set it up, how to set your own goals, how to order your watch. And this illustrates the number of points that I had obtained up until that date. I completed 4 healthy actions. So I had 845 points. At that point, I owed $8 a month for my Apple Watch that I purchased through the app. It is a 24-month contract with Apple. The watch that I selected took me at $8 per month. However, as you can see from the screen, if I earn my 8,000 points, then I would pay nothing for my watch. Also, anything in excess of the points, the 8,000 points, I can cash in for gift cards. Or if you already have an Apple Watch, you can start to cash in those points once you meet your wellness goals. These are 3 screenshots from the telephone. As you can see by the middle one, one of the challenges, go for a walk. Acknowledge that and move forward. Then you get those points. Very simple to use. I invite you, once you get your Aetna ID card, or if you have it already beginning in January, download the app, pair it to your watch, and start working your way towards your wellness goals. Next, we're going to talk about the dental. So the biggest change this year is the change to Delta Dental. So this plan is a PPO plan. This is called the PPO base plan. So your preventative care services, which are your cleanings twice a year, are covered at 100%, and your x-rays. Basic services, which are going to be cavities and emergency services, are covered at 80%, which means you pay 20%. And at that time, you will be subject to a one-time deductible of $50 for an individual or $150 as a family, and you only pay that once in a calendar year. Major services is 50-50, which means you're going to pay 50% of the cost and Delta will pick up the rest, or 50%, I should say. And the major services includes endodontics, periodontics, gum disease, root canals, things of that nature, crowns. Those are all going to be under major services. Again, each person enrolled in the plan has $1,500 to use towards their dental services, and then additional $1,000 to use towards child orthodontia on this plan. As you can tell from the screen, Delta will pay any in and out of network provider exactly the same. The difference with an out of network provider is that you have to pay the difference between what Delta pays the provider and what their actual charges are. The next plan is a DHMO plan. So this is a plan that you have to select a provider. If you don't select one, Delta will assign one based on your home zip code. Your preventative services are going to be covered at 100%. Your basic services, major services, adult orthodontia, child orthodontia, teeth bleaching, root canals, endodontics, periodontics, implants, dentures, all of those items are going to be at a fee schedule. There are no annual deductibles or no annual maximums on this plan. You just have to pick a provider and stick with that provider because everything is based on the fee schedule. This is an actual fee schedule. So this is just a diagnostic page or part of it. And you can see down the row there, enrollee pays $0. So most of these are going to be at no cost to you. All of these are going to be diagnostic or preventative services. Now you would get an ID card if you enroll in the PPO plan or the DHMO plan. You will get an ID card. If you enroll in the DHMO plan, you will get a letter similar to what's on the screen telling you who your provider is and giving you instructions on how to change it if you need to change it. Some resources available through deltadental.com. As you can see on the screen, you can print additional ID cards, you can review your benefits, what you've used, etc. And then you can also download the app to your telephone and you can have your ID at your disposal on your phone. The vision plan is the other change. So your exam is available every 12 months for a $10 copay. Your frames are available now every 12 months for a $120 allowance and then a 20% discount. And one of the biggest changes is that the frames are now available every 12 months versus every 24 months. Your standard plastic lens, single vision, bifocal, or trifocal are now going to be a $10 copay. Your contact lenses, you get an $80 allowance to use towards your contact lens purchase and then 15% off the difference. Again, this is a new contract, so if you have your old iMade card, make sure you discard that because it's no longer valid beginning of the year. It is a new network called Insight, so make sure you give your provider the new information. Voluntary life in AD&D is still available, so if you're a new hire or newly eligible, or you purchased life insurance the first time it was offered, and you did not max out, you still have that guarantee issue available to you. So 5 times your annual earnings up to $200,000 for yourself, $25,000 for your spouse, and $10,000 for dependent children. If you did not enroll the first time it was offered, you may still enroll. However, you will have to complete a series of medical questions and require to complete an evidence of insurability before you are approved. Disability is still available. These are voluntary programs. So the short-term disability covers 60% of your pre-disability earnings up to $1,000. The benefit begins after the 14th day of accident and sickness or hospitalization. The benefit lasts 11 weeks. The voluntary long-term disability, very similar, 60% of your pre-disability monthly earnings up to $7,500 a month. Your elimination period is 90 days, and this last until normal Social Security retirement age. There is a pre-existing limitation clause on both the short-term and long-term, and this coverage is off the job. So it's called a 312, which means if 3 months prior to the effective date, which would be January 1, you saw a provider, took medication, or were diagnosed for a condition in which later on in 2020 you went out on leave for, it would be excluded from being covered for 12 months. If it's a completely different diagnosis or situation, that would be payable. You also have Aflac products available to you. And in the body of the email, you will find a contact for Jason Perkins, who's going to be your representative. And he will speak to you in more detail about what the Aflac plans cover. Now, the Aflac plans are indemnity plans, which means they indemnify the owner of the plan. So they do not coordinate with Aetna, they do not call the providers, they did none of that. You do have to see a medical provider, you do have to have a diagnosis, you do have to have proof of visit to the doctor or hospital in order for Aflac to pay out. These plans are very customizable and they're based on your individual, on your age, and on your family coverage election if you want to cover yourself, spouse, children, etc. Once you enroll in the Aflac plans, you're locked in at that rate for the duration of the plan. So within the body of the email, you will find Jason's information. Please email him or call him, and he will call you to set up some time to go over the plans. You also have Legal Shield and ID Shield available to you. Within the enrollment packet, you will find information on how to enroll. Please follow the instructions, enroll online, and it will be payroll deducted. And also United Pet Care, so this is pet insurance, if you will, for all types of pets. There are no exclusions or limitations on breeds or pre-existing conditions for your pets. You also can find the information in your enrollment packet. It is an online enrollment, and it is payroll deducted as well. Again, please complete a waiver and enrollment form by December 26th. We are extending it. Your life and disability forms only if you're enrolling for the first time or making changes. Your flexible spending account only if you're enrolling. If you already completed the flexible spending account last month or in the last few weeks, you do not need to recomplete. Thank you and have a wonderful day.